Ever wonder why workouts always start with warm-ups like stretching? When your muscles are flexible, it helps your body function smoothly from mobility, stability, and even strength. In this episode, we'll learn about the benefits of flexibility and strength and why stretching exercises are equally as important. I'm Dr. Freddy Gomez and welcome to MedTalk Health Talk, only here on CNN Philippines. Our guests are here today to give insights into the benefits of being flexible and being strong. With us is Dr. Michael Francis Obispo. He is a rehabilitation medicine specialist from the Asian Hospital and Medical Center. Also joining us is Ms. Gab Venturina. She is a fitness coach and an ISSA certified personal trainer. Now, stretching someone's body to become more supple and flexible offers many physical benefits. And such training allows for easier as well as deeper movements while building strength as well as stability. Stretching your muscles and joints leads to a greater range of motion, improved balance, as well as increased flexibility. Let's talk about flexibility. Why is this something that is important not just for some, but for pretty much everyone?
The importance of flexibility is being able to move in a particular range of motion that is actually easy and also pain-free. And if there is an ease in these movements, then it affects the coordination of a person's performance in doing different activities. Flexibility, it's actually affected by genetics and also by age. As we grow older, there will be a decrease in flexibility because your soft tissues and your joints are actually affected.
A lot of people, when they hear the word flexible, they think of, prima ballerinas or track and field runners, who can do all these activities with a good range of motion. Does it solely involve the muscles? Does it involve our joints or both?
It actually involves a combination of both. So it's not just one thing, but a combination of all three. So that includes your joints, your tissues, your tendons, as well as your ligaments. So if your muscles are a bit too tense, then that could lead to less flexibility. And if you have joints that aren't as mobile, then it'll make you less flexible as well.
Does this automatically equate to being fit? When I say fit, I'm talking about ideal body weight, because we do have a lot of individuals who have a high BMI, but they are extremely flexible.
Actually, given those are actually two different things. You can't necessarily say that a person who is flexible is a person with the best body composition, is a person who is really strong. Because you can actually have both, but you can also have just one or the other. So the perfect thing to do here is to try your best to achieve a certain balance. It does not necessarily make a flexible person a strong one or a strong person a flexible one. But with good strength and conditioning training, you can actually do both.
Now, Dr. Michael, let's talk about those who are quote-unquote double-jointed. Does this make a person more flexible?
If we have patients that are double-jointed, it might be a concern for us physicians because these people might have what you call a condition called Ehlers-Danlos syndrome. So it's a condition wherein there is a problem with the collagen structure of your soft tissues, making them hyper-elastic. Now, the danger of this particular condition is because you need to balance your stability and mobility. And if you have more of your mobility, then you're actually sacrificing your stability. In fact, for patients that might have a mild degree of Ehlers-Danlos, we do find them to have more instances of having body pains because their muscles are trying to work overtime to provide the stability to their body.
Now, increasing the flexibility of the muscle tendon unit promotes better performance. But how about reducing injuries? Dr. Michael, let's talk about some stretch receptors for a second here. What is the function why someone who tries to do, say, a leg split can only do it so much before they feel some pain, some tension in their muscles?
These are your Golgi tendon organs and your muscle spindle fibers. Now, these receptors are firing if you are stretching too much or stretching too fast. They have to fire to prevent injury to the body. If these receptors are affected, then the chance of injury is a little higher.
But first, I'd like to ask Gab, when it comes to people who want to be flexible right away, what is a good time frame for someone who is considered maybe not so flexible for them to improve? What kind of realistic time frame is good in order to improve one's flexibility?
You can actually start that on a day-to-day basis. So within a span of a week, you can already see an improvement to your flexibility. But of course, the degree on how flexible you are in that week span won't be as much. So if you actually want to see big changes, like really big changes, give yourself at least a month or up to 3 months, and you'll already see a much more significant difference in terms of your flexibility.
Now, Gab, let's talk about posture. Doing yoga, practicing yoga, a good all-around way for someone to achieve both flexibility, stability, and balance? Or is there much more, is there a wider selection of activities?
For yoga, I think it's actually an excellent way to be able to develop both your strength and your flexibility. But to address the other question, whether there is a bigger spectrum out there, there definitely is, actually. There definitely is. And one thing I would say is a good workout they can do is calisthenics. Because in calisthenics, you can also work on both your flexibility, your mobility, and also your strength and endurance.
Coming up, we'll discuss more on the importance of strengthening your body as well as what you can do effectively. Only here on MedTalk Health Talk. I'm Dr. Freddy Gomez and welcome back to MedTalk Health Talk, where caring is our calling. Now, we've discussed the importance of flexibility. Now, let's discuss some of the importance of how to build that flexibility and some of the injuries that are common that may be helped if we were just a little bit more flexible. Let's talk about some of the common injuries na alam natin mga viewers. We have sprain injuries. What is a sprain? And would a sprain be avoided a little bit more if that person was just a little bit more flexible?
A sprain, or rather the more common type of sprain that we encounter is the ankle sprain. Now, a sprain is a ligamentous injury. It can be a stretched ligament or it can be a torn ligament. A strain is when the involved injury is with the muscle. You can have a pulled muscle or you can have a torn muscle, so that is a strain.
We know that whenever we try to build muscular strength, we need weight resistance in order to build muscular strength so people can lift objects. What type of strength are we talking about here when it comes to flexibility? Do we need to increase weight in order to be more flexible?
Not necessarily. It's quite different with regard to flexibility. And flexibility, you basically need to take a gradual approach. You can't rush it. You need to work on both your mobility along with it. So after you do your strength training, you have to do your stretches just to cool down the muscles and to aid recovery. Then prior, of course, you need to do a bit of your warm-ups. Then you'd notice just from there, your flexibility will actually start to improve little by little already.
How often should one focus on his or her flexibility in one's workout routine?
The average person should stretch at around 3 times a week. And the duration of this could be just within 5 to 10 minutes or a little longer if they'd like. And ideally, you could do this before and after your workout. Before the workout, you do your dynamic stretches or the moving stretches. Then afterwards, you do the static stretches. It is, in fact, a warm-up as well. But in other instances, it's actually a cool down if you're doing the static stretching.
Now, Dr. Michael, we were discussing with Gab about the benefits of flexibility and strength training as well. Let's talk about the strength involved in trying to achieve greater flexibility. Is the strength that we're talking about here more of coordination and stability?
You mix the flexibility and the stability together through coordination. So, for example, if your patient is doing a lunge So, of course, if someone is doing a lunge, you're doing flexibility of the lower extremities while you're trying to achieve stability of your core muscles. The training allows the proper coordination of these muscle units in order to provide the movement that's safe for your patient.
Will being more flexible offer some solution to those who experience low back pain? Will being more flexible be able to help in this situation?
If there's a back pain, we always try to strengthen the core, but that's not entirely true. We have to strengthen the core and at the same time try to improve the flexibility of the spine. That's why we do a lot of exercises for these patients, some mobility exercises. And we also add flexibility exercises, especially of the pelvis and of the lower extremities, because most of these patients, they develop a back pain because there's a problem with the chain, hip, knees, ankles, and the lower back. So we need to treat the patient, as I mentioned a while ago, holistically.
Now, Gab, when it comes to trying to achieve greater flexibility, will someone's metabolism be tapped into this as well? Will someone be able to have increased metabolism while they're trying to achieve increased flexibility?
They're not exactly as connected as one may think. However, when it comes to building strength, that more actually improves your metabolism. So it's not really more on the flexibility, but more on strength and conditioning training.
What would you advise those who would like to gain more flexibility but are not really looking for athletic performance for that matter? They're at their older ages, senior ages, they just want to feel a little bit better.
For simple things that they can do, that it would be really, I would advise them that it'd be helpful to practice stretches, even just the simple ones when they wake up or when they're trying to relax after a long day sitting from work. They can do their stretches, their static stretches or their dynamic stretches. And they should keep in mind that in a way it does help you with your daily life. Like, for example, if you're trying to clean in the house and you want to lift some furniture, or if you're going to get your groceries out of the car and you're going to bring it home, so they won't have as much pain as an ordinary person would if they improve their flexibility.
When we return, we'll give you tips on how to improve your flexibility and strength for your overall health. Only here on MedTalk Health Talk. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk, your partner in healthcare. Now we're talking about stretching. Now let's talk about what type of stretches can we do. Now, Gab, can you please share with us some basic stretching exercises that people can do at their own home?
We have the dynamic stretching, and we also have the static stretches. So before you do your workouts, that's when you do your dynamic stretching. In a way, it's like a warm-up for the muscles before your lifts or your other workouts. So a good example, if we're going to go from head to toe, we can do head circles. So that's just basically moving your head in a circular motion or moving it up and down and side to side. Then we can also do some shoulder shrugs. So we move our shoulders forward and backward. And if you want to work on your elbow mobility, you can also do some elbow circles. As for the wrists, some wrist circles. Then if you want to improve your hip mobility, we also have the 90-90 stretch. So that's when you position your legs in a 90-degree angle, both facing one side, and then you flip it on the other side as well. We also have hip circles, leg swings, knee circles, ankle circles, and leg swings. Then for static stretches, we can also do some holds, like the chin to chest, which is when you tuck your head like that, and you just hold it for a while, and then you do the other side and on the sides as well. We also have the wrist stretches, which would be really handy if you're working and you're on the computer the whole day. We can also do the tricep stretch or the shoulder stretches. Then for the lower extremities, we also have the hamstring stretch. We can also do a forward lunge hold, and we can also do basic squat hold as well.
When it comes to stretching, is there a certain feeling that our viewers should feel in order for them to think that they have achieved a proper stretch?
So similar to how our lifts go, you'll also feel when you're already reaching your limit. So for example, you're trying to do pigeon pose, for example, you already feel the muscles being stretched, like the target muscles in that area. So in that case, that would be a bit of the quads and the glutes. So the moment you feel that sensation and the moment that you feel just a little bit tinge of pain that is not too painful yet, but actually still feels good, then that's when you already need to relax it and to stop. So you don't need to push it to the point where you're already feeling sharp pain, because that could potentially lead you to injury. So you have to be mindful about that.
There's a common saying that no pain, no gain. Does this follow the same when it comes to trying to improve your flexibility? Kailangan bang yung kumbaga sa puntong masakit na para alam mong effective itong flexibility exercise na ginawa ko?
If there are contractures, for example, or very obvious tightness, then if you stretch it, that's okay because you more or less, you can actually see the limits of the joint. But if they already have the normal range of motion, and if the patient has these pains, then it has to be observed. Some of your receptors are firing, especially because there's some injury already occurring.
Now, Gab, before we go, do you have any tips for our viewers, especially for those who are trying to be more flexible?
Do your dynamic and static stretches. Before you work out, spare yourself a couple of minutes, 5 to 10 minutes to do your dynamic stretching. Then after your workout, especially when you do some heavy lifting, make sure to do your static stretches to relax the muscles and to aid in your recovery time.
And Dr. Michael, any words of advice for our viewers before we go?
Exercises are actually good for the body. And we always recommend that to our patients. Especially, we have a saying that exercise is medicine. Doing simple flexibility exercises like calisthenics is very much safe and okay to do for many individuals. But if you're going to be doing more aggressive stretches, abnormal position stretches, then it's best to consult your sports specialist or even your physician before engaging in these activities.
Thank you very much, Dr. Michael Francis Obispo, rehabilitation medicine specialist, and of course, Ms. Gav Venturina, our fitness expert, for being with us today, sharing your tips and expertise, especially when it comes to flexibility and strength. I'm Dr. Freddy Gomez, and thank you for watching Med Talk Health Talk. We'll see you again next time.